The Mental Capacity Act was introduced in England on October the 1st, 2007. For the first time, this legislation enshrines in law a patient's right to state what level of treatment they would like to receive if or when they lose capacity. The Deputy Head of the BMA's Medical Ethics Secretariat, Dr. Julian Sheather, is going to explain the implications of the new laws. Dr. Sheather, why is the Mental Capacity Act positive for doctors and for patients?
Because really for the first time it introduces welcome clarification of the law in relation to the provision of treatment for individuals who may lack capacity to consent to treatment on their own behalf.
But in practical terms, what has actually changed in the way patients are treated and cared for?
There's little practical change in terms of the way patients should be treated. The important thing really is that both patients and doctors will be more comfortable because the law is clarified now. So it provides welcome reassurance for health professionals and for patients and for those who are close to patients who may be losing capacity.
Could you explain the role of the lasting power of attorney?
The lasting power of attorney is one of the genuine innovations in the legislation. What it does, for the first time, it enables individuals to nominate somebody else who can make decisions on their behalf if at a future time they should lose capacity. So it brings clarification. We can all nominate an individual to make decisions on our behalf at some point in the future if we lose capacity.
Do you think the rights of vulnerable people who are dying could be exploited because of the new laws?
Absolutely not. On the contrary, in fact, the legislation introduces new safeguards. Before, oral decisions, oral advance decisions to refuse treatment could potentially have been binding. Now they must be in writing, they must be signed, they must be witnessed. So it actually increases and enhances protection for vulnerable people.
So if a doctor has a query about these laws, who should they contact?
Please contact us at the Medical Ethics Department of the British Medical Association. We'd be very happy to help.